A lot of patients ask me, why should I get a spinal fusion? Or what are the indications to do a spinal fusion of the lumbar spine? And there are three main reasons that a lumbar spinal fusion can help patients pretty significantly. Of course, there are other reasons, but the three big ones are the ones I'm going to mention now. Number one is spinal instability. It means that the bones of the spine are no longer holding up your torso and protecting your nerves in a way that allows you to live a normal life, meaning it causes pain. But more commonly, when they do that, meaning they slip and slide, it pinches the nerves in between. And that pinching of the nerves can cause severe pain. That pinching of the nerves is also called lumbar stenosis. And in those cases, by stabilizing that area that is moving pathologically, which is a fusion, can help patients with significant pain. So the first reason to consider a spinal fusion is if there's instability of the spine. The second reason that a fusion may help someone is if there's malalignment. Malalignment basically means the spine is no longer aligned over the pelvis and the legs. And the way to think about that is the Leaning Tower of Pisa. If it's nice and straight, not a problem. But when it's leaning, it takes a lot of energy to keep up the tower and prevent it from falling. Same with your torso. If you have a leaning spine, it takes a tremendous amount of energy, which can result in pain when you stand up. Other words that you may hear that are classified as malalignment are the terms such as scoliosis, flat back syndrome, positive sagittal balance, sagittal imbalance, coronal imbalance. All of these terms mean that the spine is no longer aligned in its proper form. And that's the second reason a spinal fusion may help you, is if the spine is malaligned. The third reason that a spinal fusion may help is in the face of degenerative disc disease that causes severe up and down nerve compression. What does that mean? That means is as the disc degenerates and starts to get smaller and shorter and more dehydrated, so there's less water in it, the foramen, which is the hole through which the nerve travels, begins to get compressed. We know that as the disc collapses and the foramen gets smaller, the nerve gets pinched on a very sensitive part of the nerve, and that causes pain. And that pain can be either down the leg, in the buttock, or sometimes even in the back. If the nerve is being pinched from degeneration of the spine, causing collapse of the bones that pinch the nerve, we need to elevate the bones one off the other. You need something physically strong enough to elevate bone A off of bone B so that the nerve is nice and free. So that's the third reason that a fusion may be helpful. Those are the three main reasons where a spinal fusion may help you. Spinal instability, malalignment, and degeneration of the spine causing severe foraminal stenosis or compression of the nerves in the foramen. Thanks very much for watching. See you next time.